Hi, there's Sherry here, and today we're going to be going over how to perform a COVID test. There are a lot of different types of tests that you can have for your COVID test. Today we are going to be going over IntelliSwab. So it comes with this, the fluid is going to be on this side, and then the test strip is going to be on this side, the rapid test. Okay, so what I need for this, if my doctor was going to do it, I'm going to set up a pen light so that they are able to look inside the mouth, the tongue blade in case he wants to look inside the mouth as well. Usually with complaints of COVID, they usually have sore throat complaints too, maybe. They may use the pen light to look into the nostril as well as in the mouth if they want to, or the ears. So I always put the otoscope here. You want everything ready for the doctor so they can come in, do their assessment, determine what they want to do, and move on, so that then they can give you orders or prescriptions for your patients. And then I have a couple of the swabs because I'm going to show you how you would do it if you had the swab one as well. All right, so I'm going to wash my hands. I'm going to go ahead and put my mask on. And this is just to protect it so I don't get COVID from them. Obviously, if I thought it was true COVID, I would have an N95 mask on because that's what the CDC recommends. All right, so then I'm going to apply my non-sterile gloves. Make sure you always have gloves that fit properly because it makes when you're doing things a lot easier. All right, so the next thing I'm going to do is take my swab out. So this is my test swab. I want to make sure I don't touch this. Remember, whatever we're doing a culture on or a test on, it's taking that information to determine if you have COVID or not. So what if I had it on my hands because I shook someone and I didn't wash my hands? Or, I mean, I'm getting a little crazy there, but same, you know what I'm trying to say. So you're going to take this, do not touch this area, and I'm going to go ahead and tell my patient that I am going to place this in their nostril, and I would put my hand on top of their head. I would ask if that's okay. If you put your hand here, it prevents them from instinctively going back. Just like if you're doing a swab in someone's mouth, they instinctively want to jerk back because they don't want it done. So I always just ask if I can apply my hand here, and it's very little pressure. It just kind of reminds the patient not to move back because they know they're getting the test done. They already consented to it. So it's just helping them. Then when you put this in, for this swab, you need to do it 15 swirls in each nostril. So I'm going to place it in where all of this, what's going to be testing, is going to be inside that nostril because I want to make sure that I get the swab, the mucus and everything that's in there. So I'm going to bring this in and I'm going to just swab around my nose, and I'm going to do this 15 times, okay? After I do it 15 times, I'm going to take it out and I'm going to insert it into the other one. You want to let your patient know what you're doing. So I'm going to swab 15 times. Will you zoom in? Or are you zoomed in? I can't tell. Okay. So you just go 15 times. Once you get your 15, you're going to take this and you're going to open up the lid to the fluid. Again, the fluid will have a expiration date on it, and so will your COVID test on the outside of the packet. So make sure you're always checking expiration dates on things. Then I'm going to take this and I'm going to swab it 10 times. So you see the fluid, there's not that much. I want to make sure that I do this 10 times. And then you're going to leave it in an upright position. And then you're going to set a timer for 30 minutes. After 30 minutes, you're going to come back and you're going to check your results. Once you see that the pink is coming through, that's the fluid, you know that it's at the fluid is at least getting on here. And then we'll keep watching for the control and the test result after your 30 minutes. 30 minutes, you're going to go ahead and remove the test strip, and then you're going to look at it. You're either going to have two of these lines, okay? So if there's no line in the control, then the test is void. So you would cancel it, throw it away. There's something wrong with it. So you should always have one line. If under the T, which is the test, is a line, that would mean it's positive. This is a negative COVID test because the control is working and the test has no line in it, and I know that I did it correctly. And so I would dispose of this and notify the doctor.